Hello everyone, I'm Ruan-Ching Yu from the Division of Psychiatry at UCL. I'm going to present the results of my systematic review, brief cognitive assessments used clinically for Chinese patients in the diagnosis of dementia and MCI. As you may be aware, Chinese language is one of the most commonly spoken languages in the world and is a national language in China, Taiwan, Malaysia, and Singapore, but actually they share quite different cultural context and health status. And previous research has shown that brief cognitive assessments can help early diagnosis of suspected dementia and MCI. It is really important to select the most appropriate brief assessments according to the history and demographic features of individuals. In this study, we searched the terms related to assessments, dementia, MCI, and Chinese-speaking populations. The database include MBES, OV-Medline, PsycInfo, PsycTest, Web of Science, and the Cochrane Library. Our included criteria are as follows. The measure is validated as part of the study. It's used for diagnostic purpose. It's conducted in Chinese-speaking populations. It should be cognitive assessments. It's carried out in a memory clinic or other similar setting. It takes fewer than 20 minutes. It's assessing the patient directly, not through an informant or telephone. In this study, two raters assessed full text of potentially eligible study independently, and then rated translation and cultural adaptation process through using Manchester Translation Reporting Questionnaire and Manchester Cultural Adaptation Reporting Questionnaire. For quality analysis, they use CEBN criteria. So in the end, we retrieved 11,763 articles in total, and included 33 articles in the final analysis after full-text screening. There were 14 articles from China, 5 articles from Hong Kong, 5 articles from Singapore, and 9 articles from Taiwan. The inter-rater reliability achieved 90.9% and 93.9% in translation and cultural adaptation process respectively. The sensitivity and specificity of different short cognitive assessments are shown on the 4 figures. As you can see, of the 3 instruments with the best sensitivity and specificity in China, MoCA discriminated MCI from normal controls, A3 discriminated dementia from normal controls, and Test Your Memory discriminated AD from normal controls. And of the 2 top performing assessments in Hong Kong, MoCA differentiated MCI from normal controls, and ACE-R differentiated dementia from normal controls. Of the 2 best assessments in Singapore, MoCA distinguished AMCI with more than 10 years of education from normal controls, and the Short Portable Mental Status Questionnaire distinguished dementia with more than 6 years of education from MCI and normal controls. And lastly, of the 2 best assessments in Taiwan, MoCA recognized AD and MCI from normal controls, and Taiwan version of MCI screen recognized dementia from MCI. Interestingly, in translation process, there was only 21.2% of articles fully reported every steps of translation. And in cultural adaptation process, there was only 39.4% of articles reported the procedure of translation comprehensively. Thank you for listening.